Good day, my name is Danielle Villaseñor from BSN 1B. For this video, I'll be baiting a client. For the overview of the skill, baiting is an essential component of nursing care. Whether the nurse performs it or the nurse delegates it to other healthcare provider, it is the nurse's responsibility that the hygienic needs of the clients are met. The type of bath given are dependent upon the client's ability to perform self-care and the purpose of the bath. Now, there are two categories of bath which are therapeutic and cleaning. Cleaning baths are usually given as a routine in order to maintain personal hygiene of the clients. Now, there are 5 different types of baths for clients. There is shower, tub, self-help or assisted bath, partial bath, and complete bed bath. For clients who are confined to bed, bed bath is usually given to them. Now, there are different types of bed baths depending on the client's ability to participate with the process. Complete bed bath is given to clients who are completely dependent and confined to the bed, while the nurse usually cleans the entire body during the complete bed bath. A partial bed bath and self-help or assisted bath are variation of complete bed bath. For the assessment, first you're going to have to assess the client's ability to assist with the bath. Determine if the client is able to follow directions. Check the client's ability to assist with the cleaning in any portion of the body. Second, you're going to have to assess the client's level of comfort with the procedure. Check into potential cultural, sexual, or generational issues. Determine whether the client is uncomfortable, tense, or nervous about being baited by someone else. Third, you're going to have to assess the environment. Verify that the equipment needed is available. Check whether clean, warm water is available. Determine whether the need for modesty and privacy can be met. The environment should be conducive to a clean and comfortable procedure. For the planning, the expected outcomes for this procedure includes 1. The client will be cleaned without damage to their skin. 2nd, the client's privacy will be maintained throughout the procedure. 3rd, the clients will participate with their own hygiene as much as possible. And 4th, the client will not become overly tired or experience increased pain, cold, or discomfort as a result of the bath. For this procedure, you will need the following equipment: bath towels, washcloths, bath blanket, wash basin, soap dish, lotion, deodorant, powder, clean gown, clean linen, and disposable gloves. For the implementation, assess the client's preferences about bathing. This provides clients opportunity to participate in care. Second, you're going to explain the procedure to the client. This enhances their cooperation.
Good afternoon po, ma'am. My name is Danielle Villaseñor. I'll be your student nurse from NERC. So first po, ma'am, may I know what your name is?
My name is Kali Makaso.
Okay po, Miss Kali. So, Miss Kali, ngayon po ang gagawin ko po is bibigyan ko po kayo ng bed bath. So, given your situation, medyo mahirap po para sa inyo na pumunta ng CR para maligo. So, gagawin na lang po natin ito sa bed niyo. At i-assess ko po kayo. Is that okay with you po?
Okay lang naman.
Okay po, ma'am. So, do you have any preferences po sa pagligo niyo?
Huwag lang sana masyado malamig.
Okay po, ma'am. Sige po.
Third, you're going to prepare the environment. Close the doors, windows, adjust temperature, provide time for elimination needs, and provide privacy for the client. This protects the client from chills during bath and increases the sense of privacy for them. Then you're going to wash your hands and apply gloves. The gloves should be changed when emptying the water basin. This reduces the transmission of microorganisms. Position the client in a comfortable position close to the side near you. This prevents unnecessary reaching and facilitates the use of good body mechanics. 6. If the bath blankets are available, place bath blanket over the top sheet. Remove top sheet from under bath blanket. Remove the client's gown. Bath blankets should be folded to expose only the area being cleaned at a time. Top sheet or towels may also be used for bath blankets. This prevents the exposure of the client and promotes their privacy, and this also protects them from chills. Seven, fill the wash basin 2/3 full. Permit the client to test the water temperature with their hand. This prevents accidental chills or burns to the client.
Miss Kali, have you tested the water? Okay lang po yung temperature niya.
Oo, okay na yan.
8. You're going to wet the washcloth and wring it out. This prevents the unnecessary wetting of the client. Then you're going to make a bath mitten with the washcloth. This prevents the ends of the washcloth from dragging across the skin. Also, this promotes friction during bath. Then you're going to wash the face and ask the client about the preferences using soap on the face.
So, ma'am, do you use a different soap po pagka sa face po ninyo?
Yung katulad lang din ng sa katawan.
Use a separate corner of the washcloth for each eye. Wiping from inner to outer canthus. Wash neck and ears. Rinse and pat dry. Some clients may not use soap on their face. Using a separate corners of the washcloth reduces the risk of transmitting microorganisms. Patting dry reduces skin irritation and drying. Wash arms, forearms, and hands. Wash forearms and arms using long firm strokes in the direction of distal to proximal. Arms may need support while being washed. You're also going to have to wash the axilla, rinse, and pat dry. Apply deodorant or powder if desired by the client.
Daddy, would you like to use a deodorant po?
Sure.
Okay po.
Immerse the client's hand into the basin of water. Allow hand to soak for about 3 to 5 minutes. Wash hands and interdigit area, fingers, and fingernails. Rinse and then pat dry. Long strokes promote circulation, and the soaking of hands softens nails and loosens soil from skin and nails. Strokes directed distal to proximal promote venous return. Then you're going to wash the chest and abdomen. Fold the bath blanket down to the umbilicus. Wash the chest using long and firm strokes. Wash the skin fold under the female client's breast by lifting each breast. Rinse and pat dry. Fold the bath blanket down to the suprapubic area. Use another towel to cover the chest area. Wash the abdomen using long and firm strokes as well. Rinse and pat dry. Replace bath blanket over chest and abdomen. Cover chest or abdomen area in between washing, rinsing, and drying to prevent chilling. This promotes the privacy and prevents chill. Also, perspiration and salt collects within the skin fold, so they should be cleaned. You're going to wash the legs and feet. Expose the leg furthest from you by folding the bath blanket to the midline. Bend the leg at the knee and grasp the heel. Elevate the leg from the bed and cover the bed with bath towel. Place wash basin on towel. Place the client's foot into the wash basin. Allow foot to soak while washing the leg with long firm strokes in the direction of distal to proximal. Rinse and pat dry. Clean the soles, interdigits, and toes. Rinse and pat dry again. Perform the same procedure on the other leg and foot. This supports the joints to prevent strain and fatigue. Soaking the foot loosens dirt, softens nail, and promotes comfort. You're going to wash the client's back. Assist the client into prone or side-lying position facing away from you. Wash the back and buttocks, giving long and firm strokes. Rinse and pat dry. Give back rub and apply lotion. This exposes the back and buttocks for washing. The back rub promotes circulation and relaxation for the client. For the perineal care, assist the client to supine position and perform the perineal care. This removes the genital secretions and soil. Then you are going to apply lotion and powder as desired by the client.
Ma'am, meron pa po ba kayong gusto palagyan po ng lotion? Gusto niyo po ng powder?
Pwede mo pa-lotion lang ng binte saka ng braso ko.
Then you're going to dress the client with a clean gown. The lotion lubricates the skin while the powder absorbs excess perspiration. temperature sheets po. Bibigyan ko po kayo ng bagong blanket.
Okay, ma'am, please turn to your side po. So, ma'am, Kali, do you feel comfortable po?
Yes, I'm comfortable
Okay
naman.
lang po kayo. Do you have any complaints po? Meron po masakit?
Wala naman.
Ma'am. So, yun lang po, ma'am. Thank you po.
Then you're going to document the skin assessment, type of bath given, and client outcomes and responses. This provides evidence of the nursing care. Lastly, you're going to wash your hands, reducing the transmission of microorganisms. For the evaluation, the client was cleaned adequately without skin damage. Second, the client modesty was maintained throughout the procedure. Third, the client participated in the procedure as much as possible. Fourth, and lastly, the client remained comfortable during the procedure. For the documentation, you have to note in the nurse's notes that the client was bathed and indicate how much of the bath the client assisted with and how well the client tolerated the activity. You're also going to have to note any unusual findings in the skin, including rashes, open sores, port sugar, and so on. That is all for my video. Thank you for watching.